Coming to question number 17, you have a 55-year-old man was noted to have significant memory loss and difficulty sleeping. Approximately 1 month later, his wife noticed he had multiple episodes a day where he would stop talking, lift his left arm with his left elbow flexed, and a grimace with his face appearing to twist towards the left like this. So this is a typical type of a seizure called as FBDS. That's called facio-brachial dystonic seizures. She brought him for urgent evaluation. On serum testing, he was found to have a particular antibody that explained this constellation of symptoms. This seizure semiology is highly suggestive of which form of encephalitis. If you have a patient with FBDS, the next thing you have to do in exams is to make a diagnosis of anti-LGI1 related encephalitis. That's all. This is so characteristic of this disease. And what about NMDA receptor antibody encephalitis? This is very common in females, especially younger females, the 20s and 30s. Our patient in question is older and he's a male. At the same time, most of the patients with NMDA receptor encephalitis will come with psychiatric symptoms. They'll have behavioral changes and they can have dyskinesias, especially orofacial dyskinesias. Very, very important point. And very important association with NMDA receptor encephalitis is the ovarian teratoma. Almost 50% of the patients will have associated ovarian teratoma, which means NMDA receptor encephalitis can be a paraneoplastic syndrome. And if you do MRI, you will see classic limbic encephalitis. There will see bilateral medial temporal lobe hyperintensities in FLAIR imaging. And sometimes after herpes simplex virus encephalitis, almost 20 to 30% of them can develop NMDA receptor antibodies, which can result in relapsing encephalitis in these people. Okay, now what about Casper2? Casper2 antibody-related encephalitis will not be associated with tumors generally, but they will tend to produce a characteristic finding called as neuromyotonia. It can be isolated or it can be associated with a syndrome called as Morvan syndrome. So what will be the classic findings in Morvan syndrome? Patients will have insomnia, patients will have encephalopathy, and patients can have neuromyotonia. That's Morvan syndrome. And what about anti-WHO encephalitis? Anti-WHO encephalitis usually will have association with cancers commonly, especially small cell lung cancer. And most of the times they're going to produce encephalomyelitis, or they can produce cerebellitis and cerebellar degeneration. So I can say that NMDA and anti-WHO are going to be commonly associated with cancers, and Casper2 and LGA1 related encephalitis are going to be rarely associated with cancer. They don't really have any much associated with cancer. Right answer for this question is option C, that is anti-LGI1 related encephalitis.
Subscribe and press the bell icon so you never miss an update from PrepLadder.